This video contains a truth that has changed the lives of many people. If you are having health problems and have ever felt stuck, please subscribe to the channel and leave a comment in the comment section so we can share useful knowledge together. Have you ever found yourself in a late-night Google spiral, asking questions you were too embarrassed to say out loud? Maybe something like, can I get an STI from a toilet seat? Or if my partner looks clean? We're safe, right? If so, you're not alone. And you're definitely not the first to quietly panic over something that turned out to be a total myth. The truth is, we live in a world where misinformation about sexual health spreads faster than the infections themselves. And the worst part? Shame and silence keep us from talking about it openly, which only fuels more fear and confusion. That's exactly why we need to have this conversation right here, right now. So let's lay it all out on the table. No judgment, no awkward lectures, just real talk about sexually transmitted infections, what they are, what they aren't, and how to separate the facts from the nonsense. Because when you've got the right information, you can protect your health, protect your relationships, and sleep better at night. In this video, we're going to bust some of the most common STI myths that are still floating around out there. And I promise once we're done, you'll feel more confident, more informed, and definitely more at peace. And hey, before we get into it, if there's something you've been struggling with, questions you've been too afraid to ask your doctor, symptoms you're not sure about, or even relationship worries, drop them in the comments. You're not alone, and this is a space where your voice matters. Let's get into it. Let's start with one of the biggest myths I hear all the time. If I don't have any symptoms, I can't have an STI. That one's dangerously wrong, and I mean dangerously. Here's the thing, many of the most common STIs, like chlamydia, gonorrhea, herpes, and even HIV, can live in your body without showing a single symptom for weeks, months, or even years. You could feel totally fine, look totally healthy, and still be carrying something without knowing it. And that means you could pass it to your partner, too, without either of you realizing it. Let me give you a real-life example. A patient of mine, let's call her Sarah, came in for a routine checkup. She's in her early 30s, in a committed relationship, and said she felt completely healthy. Just wanted to get some labs done to be safe. Good call, right? Turns out, she tested positive for chlamydia. She was shocked. No symptoms, no discomfort, no idea. If she hadn't come in, she might have gone months or longer without knowing, and risked serious complications like infertility down the line. That's how sneaky these infections can be. So no, feeling fine doesn't mean you're in the clear. The only way to know is to get tested. And getting tested isn't something to feel ashamed of, it's something to be proud of. It means you care about your health and your partner's health. Period. Now, let's talk about another classic. You can only get an STI if you're sleeping around. Oh boy, that one is dripping with shame, and it's just not true. STIs don't care if you're single, married, monogamous, or if you've only had one partner your entire life. All it takes is one encounter. That's it. You could be in a committed relationship and still get exposed, especially if one partner was exposed in the past and didn't know it. I had a patient in his mid-50s, I'll call him Tom, who had been married for over 20 years. His wife passed away, and after a couple of years, he started dating again. He met someone, they hit it off, and after a few months, they became intimate. Nothing out of the ordinary, but he ended up contracting herpes. Not because he was reckless, not because he was sleeping around, but simply because life changed, and he didn't know what to ask or what to expect. This isn't about judgment. This is about awareness. STIs don't come with a moral compass. They don't care about your relationship status. They don't ask for permission. That's why open communication, mutual testing, and smart prevention are so important at any age, and in every kind of relationship. Let's move on to a myth that just won't die. You can catch an STI from a toilet seat. I get it. Public bathrooms aren't exactly the most hygienic places on earth. But let me put your mind at ease, STIs don't spread like that. The viruses and bacteria that cause STIs can't survive long outside the body, especially not on cold, hard surfaces like toilet seats. You're not going to catch chlamydia, gonorrhea, or syphilis from sitting down. You're more likely to pick up germs from touching the faucet or door handle than from the seat itself. Now, I'm not saying public toilets are clean, we all know better, but ST is not the thing to worry about there. What you should be more concerned about is unprotected contact during sex. That's where real risk comes into play. Condoms, dental dams, regular testing, those are your frontline defense. Not hovering over a toilet like you're doing a squat challenge. And let's not forget this gem. If someone looks clean, they're probably safe. I wish it worked that way. I really do. But the truth is, there's no STI look. Someone can be attractive, healthy, well-groomed, and say all the right things and still carry an infection without knowing it. This isn't about mistrust, it's about protecting your body and your future. I always tell people, trust is important in a relationship, but so is honesty and shared responsibility. If you care about someone, or even if it's just a what I'm encounter, ask the questions. Get tested together. Use protection. That's not a sign of distrust, it's a sign of maturity and self-respect. Let me leave you with this for now: your health is yours to protect. And there is nothing embarrassing about being smart. Whether you're 18 or 80, whether it's your first relationship or your 50th, understanding the facts about STIs is one of the most empowering things you can do for yourself. So far, we've peeled back the curtain on a few myths that might have been holding you back from getting the answers you need. There's still more to uncover. And now that we've cracked a few of the big myths wide open, let's talk about one that causes a lot of fear and, honestly, a whole lot of shame. Have you ever heard someone say, if you had an STI, you definitely know it? That's one of the most dangerous lies out there. The truth is, most STIs don't come with big flashing warning signs. In fact, many people who carry an STI feel perfectly fine. No fever, no pain, nothing strange at all. And that's exactly why these infections spread. It's not because people are careless, it's because they don't know. Someone can have chlamydia, gonorrhea, or even HIV for weeks or months without symptoms. They go about their daily lives, working, dating, living normally. They don't feel sick, so they don't get tested. And without testing, there's no treatment. That's why regular screening is so critical, especially if you're sexually active with new or multiple partners. Getting tested doesn't mean you're reckless. It means you care. It means you're taking responsibility for your health and the health of your partner. It means you're brave enough to have the facts no matter what they are. And here's a beautiful truth. Many STIs, especially the bacterial ones, are completely curable. A quick round of antibiotics and boom, cleared up. Let's pause on that for a second. Imagine walking around for months thinking something's wrong with you, imagining the worst. Afraid of rejection, when the reality is a few pills and it's over. That's the power of information. That's the peace of mind that testing can give you. Now, there's another lie that's been floating around forever. And it sounds like this: only people who sleep around get STIs. Let's be very clear, STIs don't care about your relationship status, how old you are, how much you love someone, or how many partners you've had. You can be in a monogamous marriage and still get an STI. You can have just one partner your entire life and still be exposed. I've treated patients who got an infection from a spouse who had cheated. I've seen newlyweds, high school sweethearts, people in their 60s dating again after divorce. Life is complicated, and STIs don't discriminate. They follow biology, not judgment. This idea that STIs only happen to those people, it creates silence. It creates shame. And that silence, that's what lets infections grow unnoticed. Because when we're afraid to talk about something, we don't ask questions, we don't get help, and we suffer in silence. But what if we flip that script? What if we treated STI testing the way we treat a routine blood pressure check or dental cleaning? What if we said, hey, I care about myself and I care about you. Let's get tested together? That one simple conversation could be life-changing. It could protect your health, your relationships, your peace of mind. And that brings me to another truth we need to unpack. This one's especially hard for people who were raised in environments where sex wasn't openly talked about. A lot of people still believe that if you talk about STIs with your partner, it means you don't trust them. But here's the thing, talking about sexual health is not a sign of mistrust, it's a sign of maturity. It shows courage. It shows you value both your well-being and theirs. Think about it this way: if you were going to drive a car with someone, wouldn't you want to know the brakes work, the seat belts are functional, That's not about suspicion, it's about safety. The same goes for relationships. A real partner will respect you for bringing it up. A real partner will want you both to feel safe, cared for, and informed. If someone shuts down the conversation, that's not your failure, that's a signal. You deserve someone who values your voice, your questions, your need for clarity. And look, I get it. These conversations aren't easy. You might feel awkward or afraid they'll react badly. But I promise you this silence is scarier. Not knowing is worse. And once you've had the talk once, it gets easier. It becomes normal. And when it's normal, it becomes empowering. Let me tell you something else people don't always realize. Age doesn't protect you from STIs. In fact, in recent years, there's been a rise in STI cases among people over 50. Why? Because many older adults are re-entering the dating scene often after divorce or the loss of a partner, and they may not think about condoms or testing. They grew up in a different time when the risks were different and the conversations were rare. But the risks are still real, and your health still matters at every age. Whether you're 22 or 72, you have the right to a safe, satisfying sex life. You have the right to protect yourself without feeling embarrassed. So whether you're in a long-term relationship or dating again after years, don't let age hold you back from speaking up. Don't let fear stop you from asking for a test. It's your body, your peace of mind, your power. And if you've ever felt alone in this, I want you to know you're not. There are millions of people, just like you, who've had questions, made mistakes, felt confused, or scared or ashamed. But the difference between fear and freedom is knowledge. That's why we're having this talk. That's why you're here. And I'm really glad you are. Let's keep going, because we're not done busting myths yet. Let's talk about something that runs deeper than any infection: shame. Shame is a powerful emotion. It can make you feel small, dirty, broken even when you've done absolutely nothing wrong. And for a lot of people, just hearing the letters STI triggers that feeling instantly. Not because they've been reckless, not because they don't care, but because the world has taught them that sexual health is something to be whispered about or hidden altogether. Here's what I want you to hear loud and clear. Having an STI does not make you dirty. It doesn't make you stupid. It doesn't make you less worthy of love, respect, or joy. It just means you're human. We don't shame people for catching a cold or the flu. We don't say someone deserved diabetes or asthma. So why do we treat STIs differently? Why do we turn a common medical condition into a moral judgment? That stigma is not just harmful, it's dangerous. It keeps people from getting tested. It keeps them from telling their partners. It keeps them isolated, scared, and silent. But you don't have to live in that silence. You don't have to carry the weight of stigma anymore. The truth is, millions of people have had an STI at some point in their lives. Your co-worker, your neighbor, your college professor, that person you follow on social media who seems to have it all together. This is not a rare, shameful secret, it's a part of life. And here's the good news. You can have an STI and still have a thriving love life. You can have an STI and still have children. You can have an STI and still be in a happy, healthy relationship with someone who respects you. Because your diagnosis is not your identity. It's a detail. It's manageable. And in most cases, it's temporary or completely treatable. Now, let's bust one more huge myth, one that's been weaponized in relationships and even courtrooms. People with herpes or HIV are dangerous. No, people with infections are not dangerous. They are people. Let's talk about herpes for a moment. It's estimated that over half of adults in the US have HSV1, commonly associated with cold sores, and around 1 in 8 have HSV2, commonly genital herpes. Most don't even know they have it. Many never experience symptoms. And those who do, there are medications that suppress outbreaks and lower the risk of transmission dramatically. And HIV, we've come so far. With today's treatments, a person living with HIV who's on medication and has an undetectable viral load cannot transmit the virus through sex. That's not a hopeful guess, it's a scientific fact. Undetectable equals untransmittable. It's called U equals U, and it's changing lives. This isn't the 1980s. We're not in the dark anymore. Science is on our side, and knowledge gives us power to protect ourselves, power to love without fear, Power to choose connection over isolation. So if you've been diagnosed with an STI, I want you to remember this. You are not alone. You are not ruined. You are not untouchable. You are capable of deep, beautiful, safe intimacy. You are worthy of compassion. You are still whole. Now, if you've never had an STI, but you're scared of the topic, ask yourself, what are you really afraid of? The infection or the shame that comes with it? Because once you strip away the stigma, what's left is something you can face, something you can treat, something you can manage. And here's where it gets real. STIs are not just a medical issue. They're a mental health issue, a relationship issue, a self-esteem issue. And we can't solve those things with antibiotics alone. We solve them by talking, by listening, by learning, and by loving ourselves enough to seek truth over fear. So whether you're sitting in your room feeling overwhelmed or you're driving to a clinic, heart racing, know this: you're not broken. You're brave. You're informed. You're choosing to take control. And that is powerful. In just a minute, we'll go over what real STI prevention looks like, not the fear-based version, but the facts that help you make confident choices, whether you're single, dating, married, or somewhere in between. But first, take a deep breath. You're doing something amazing right now. You're replacing fear with knowledge, and that's how healing begins. Let's get practical for a moment. You've got the truth in your hands now. The myths are crumbling. The fear is losing its grip, and what's left? Clarity, power, control. So now you might be wondering, okay, how do I actually protect myself and the people I care about without losing the ability to connect, to feel close, to enjoy intimacy? That's the sweet spot we're aiming for. And believe me, it's absolutely possible. You don't need to live in fear. You don't need to swear off sex or avoid dating or feel like you're constantly walking on eggshells. You just need information, intention, and a little bit of courage. Let's start with testing. Getting tested regularly is one of the kindest, most respectful things you can do, not just for others, but for yourself. It says, I care enough to know. I care enough to take charge of my health. And no, you don't have to wait for symptoms. In fact, many STIs don't have obvious symptoms at all. You could feel completely fine and still be carrying something without knowing. That's why regular testing, especially when you're starting a new relationship, or if you've had unprotected sex, is essential. Think of it like brushing your teeth. It's just part of taking care of yourself. Now here's the key. Testing isn't awkward or shameful. It doesn't mean you're risky or irresponsible. It means you're proactive, responsible, strong. Most clinics make it quick and easy. Some even offer at-home STI test kits that you can do in complete privacy. No judgment, no lectures, just answers. Let's talk about protection, too, because this is where myths love to sneak in. A lot of people think, I'm on birth control, so I'm good. But here's the thing. Birth control protects against pregnancy, not STIs. For STI prevention, you need barrier methods like condoms and dental dams. They may not be perfect, but they reduce your risk dramatically when used consistently and correctly. And for those who are at higher risk for HIV, PrEP, pre-exposure prophylaxis, is a game changer. It's a daily pill or even a shot now that reduces the risk of getting HIV by up to 99%. That's the power of modern medicine. We're not helpless. We have tools, and when we use them together, they work. Now, let's talk about the part that makes most people squirm a little: the conversation. You know the one. So, have you been tested? What's your STI status? Can we talk about protection? Most of us were never taught how to have that talk. But let me tell you, it's not just possible, it's essential. And it doesn't have to be scary. In fact, it can build trust. It can bring you closer. Because when someone is willing to have that conversation, they're showing maturity, respect, courage. If you're nervous, try this. I really like where this is going. And I think it's important we talk about our sexual health. That's it. Simple, direct, caring. You don't have to have all the answers. You just have to show up honestly. And if someone reacts with anger or shame or tries to guilt you for asking, that's not your person. You deserve someone who wants to protect both of you, not someone who avoids the conversation out of ego. Here's another truth. People with STIs have healthy, loving, beautiful relationships all the time. Some people date others with the same condition. Others are in mixed status relationships and keep each other safe with medication and communication. There is no perfect or clean person. There are only people doing their best with the information. They have to care for themselves and others. So if you're dating or thinking about becoming sexually active, here's your toolkit. Get tested regularly. Use protection. Talk openly. Treat people with compassion, including yourself. That's it. That's the real secret. Not fear, not shame. Just simple, honest, human care. And if you ever test positive, take a breath. You're not doomed. Most STIs are treatable. Many are curable. All of them are manageable. Your life doesn't end with a diagnosis. Sometimes it actually begins because it wakes you up. It pushes you to grow. It teaches you how strong you really are. So if you're watching this right now and you've been carrying shame, guilt, or confusion, let me say this with all the love and honesty I can. You are not your status. You are not your past. You are not dirty, dangerous, or damaged. You are a whole, vibrant, beautiful person deserving of health, love, intimacy, and peace. If this video helped you in any way, I invite you to leave a comment. Share your thoughts, your questions, your experiences. You never know who you might help just by speaking up. This community is here to support you, not judge you. And if you found this valuable, please like this video and subscribe to the channel. We talk about real things here, things that matter, things that heal. Because you deserve truth, you deserve love, and you deserve to live fully without shame holding you back. Here's to your health, your heart, and your wholeness. Take care of yourself. You've got this.